A stunning smile is the cornerstone of many people's confidence, but healthy teeth require care. Comprehensive daily oral care is the key to total mouth care. Despite the delicate balance required to keep your teeth in the best shape, many people don't think about the possibility of losing teeth. But tooth loss doesn't happen after skipping a few brushing sessions. So, what causes tooth loss? There are more underlying issues than you think, and dentist Dr. Bhavesh Vallabh is here to tell us more. Good day, doctor, and thank you for joining me.
Good day. How are you doing, William?
I'm good, thanks, and yourself?
I'm good, thanks. Thank you for the opportunity.
All right, welcome to the show. Now, what are the most common causes of tooth loss, especially in adults?
Okay, so recently I've been actually, correlating research and my clinical work together, and it actually correlates quite well. Research says
Hmm.
that the number one the reason for tooth loss is periodontal disease, and I'm seeing that every day with patients coming in and like, doc, my tooth is sore, it's loose, and I need to like take it out because I can't handle the pain. And you see
Mm-hmm.
that very commonly where patients are coming in with more problems of gum disease and periodontal disease and actual tooth decay. So for me, and according to the American Dental Association, is that periodontal disease is the number one cause of tooth loss. So in
Mm-hmm.
layman's term, okay, so let's talk the oral cavity of the mouth, right? So we have the
Yes.
teeth, we have the gums, and we have the supporting structures like the bone, right, that holds the teeth. So periodontitis is inflammation of the periodontium, which is the structures such as the bone and the gums. So it initially starts off as gingivitis, which is just inflammation of the gum, and then it proceeds to periodontitis, which is both inflammation of the gums and the bone. And when the latter occurs, it's when the teeth has no supporting structure and they just become loose.
Mm-hmm.
And like
Mm-hmm.
common causes of periodontal disease, like your diet, it's actually hereditary as well. Smoking, alcohol intake, and your lifestyle habits.
Mm-hmm. Right now, what should you do when your teeth start falling out?
Okay, so let's try, let's try and get to the point where we don't lose any teeth. That's
Yes.
most or I think all dentists advocate for that. Like we don't want to lose a tooth. So it starts off with your habits or the person's habits is like brushing twice a day for around 2 minutes, using a toothpaste of choice, and maintaining a good lifestyle. So maintaining a healthy lifestyle. So watching your diabetes. So your sugar intake should be regulated. Having a good diet. Having a balance of proteins, carbohydrates, fruits, and vegetables. And recently, I've seen that, in younger children compared to younger children previously, there is a decline in oral health because of the amount of refined foods we're eating. We eat softer foods, we eat more sugary foods, we drink more cool drinks, more juices, and stuff like that. So I
Mm-hmm.
would suggest that, going to a balanced diet. Number one is maintaining a balanced diet. Number two is maintaining good oral health from your perspective. Like I said, brushing twice a day, um, flossing every second day or every day, keeping your tongue clean, and then, not smoking, maintaining your health in terms of sugar, in terms of hypertension and certain things like that. If that can be done and incorporated with, visiting your dentist twice a year, oral health will be maintained and we won't get to such a stage.
Mm-hmm. All right, now there are people out there, some of us who don't go
Yes.
visit dentists at all. And until we have a problem, that's when we decide, no, I think I need to go and visit the dentist now. How important is a dentist visits?
Um, Very important. See, the thing is that your toothbrush and your like oral hygiene habits at home only reaches a certain level. Like your
Mm-hmm.
toothbrush can't get inside the gums, it can't get between the teeth and all of that. And once your food with your saliva accumulates inside the mouth, it goes from being plaque, which is the softish, like that dirt which you can scrape on your teeth, into something called calculus, which is hard. And a toothbrush is not going to be able to take that out. And once that
Hmm.
starts to accumulate inside the gums and on the teeth, is what causes the gingivitis and then periodontitis. So coming to us every 6 months is we take out that calculus, we prevent it from building up, so that you maintaining a normal brushing, habit at home is easier. Because some patients are like, it's too sore to brush. It's because the gums are
Mm.
inflamed. So we don't want to get to that point. And I tell my patients as well is that if you can't make it every 6 months, once a year is still fine. But let's not try and push it any longer.
Or wait to the last minute when teeth are
Yeah,
actually starting to fall off.
no, definitely. Because the thing is, when you get to that point, it becomes more expensive. It becomes painful for the patient. So you don't want them to ever get to that point. And I know that, dentistry is quite expensive in South Africa, but preventing is much cheaper than, treatment actually. So if you can
Mm-hmm.
start and like, let's just say you have a tooth which has a cavity, if you can fill it in its initial stages, it's much cheaper than going when the tooth has now a massive hole in it, and then we have to either consider root canal or an extraction or something like that.
Mm-hmm. Now, what does tooth loss say about one's health?
Yeah, so the mouth is actually a very good indicator of your overall health. Number one, your gums can indicate your red blood cell count. So it will show you that if you are anemic, it can show you your healing process. So it will indicate diabetes. Um, the bleeding would indicate hypertension. So what the dentist sees in your mouth is more than what is just face value. It's actually your whole body, which he can kind of, understand what's happening with you and why it's not controlled or what's happening. So in terms of diabetes, gums would be swollen. There would be delayed wound healing. In terms of hypertension, there would be inflammation of the gums, bleeding, anemia where the gums would look pale. So there's a lot of indicators just picked up just from the mouth itself.
Mm-hmm. Yeah, I didn't know that the mouth could actually tell a lot that's going on in your body just by
Yeah.
just saying ah.
Yeah, no, there's a lot. And that's the thing is that going to the dentist is not just for cleaning and maintenance of
Mm.
good oral health. Also, it's like you can the doctors can pick stuff that you might not know, and then indicate you or tell you to go for certain tests and then figure it out, and hopefully get it controlled.
Hmm. Well, doctor, you've just given me a new perspective onto a problem that I've been trying to figure out what's going on. Doctors couldn't even tell me what's happening. So perhaps I need to visit the dentist. Maybe they could give me a different perspective. All right.
Definitely.
That's now once the teeth start falling out. I mean, we don't want that to happen. But if it does happen, what happens to your jaws when you lose your teeth?
Okay, so like a patient comes in there and then be like, "Doctor, this is too painful. I need to take it out." So taking
Mm-hmm.
out a tooth is one thing. It's getting rid of the pain, it's getting rid of the infection or the cause. But the problems that correlate with it, it's much worse. Is that I was always taught by my lecturer that taking out a single tooth causes problem to three teeth. The two adjacent teeth that were next to this tooth starts to move because that's how the teeth move. They physiologically move in the mouth wherever there's a space, right? So these two teeth are now going to try and close that gap. So now we're going to get shifting of those bottom two teeth. And the tooth that's adjacent to it on top is going to either grow down or the one from the bottom is going to grow out. So it actually changes the whole correlation of the jaw. Why? Because now those teeth that were supposed to be in their correct position have moved. So it's putting pressure on your jaw. So over time, you'd see that you'd have pain in your TMJ or your temporomandibular jaw just because we're now changing the harmony of the mouth.
Mm-hmm. And then, what are the best solutions for missing teeth?
So it definitely comes back down to affordability and what we can afford, but there's many options. So it would come down to if a patient can afford or something permanent, there's implants which can be placed with a crown that they place on top, or we can go for something more fixed, which is like a bridge. A bridge is like a artificial tooth where we use the two adjacent teeth for support and a dummy in the middle. So those two are permanent options where we don't remove them. They permanently in the mouth. It looks like your normal teeth. And then we get removable options which are slightly cheaper, which are your dentures, like, with the ones you take out at night.
Mm-hmm.
So all we're doing is we need to we return the function and harmony of the mouth back to normal. So we look at the most affordable option for the patient and what's the most what you call this the best solution for that. Because sometimes the cheapest option is not actually the best option. So we try to, you know, explain to our patient the importance of certain aspects and all of that, but not breaking the bank as well.
Hmm. Now, when it comes to pregnancy, I know the hormones affect the body in a lot of ways. Can it also affect mouth care, oral care?
Yes, definitely. So during pregnancy, there's an imbalance of the hormones. So number one is that the patients would actually, or the females would see that the gums are swelling, there's some bleeding, it's actually painful. But we don't advocate for any treatment during pregnancy, especially, unless it's emergency treatment. So what we do initially, we try and maintain a good oral hygiene, and then during
Mm,
pregnancy, we advocate for brushing twice a day, changing maybe to a softer toothbrush, um,
mm,
using a warm saltwater gargle. Nothing that is quite harmful to the patient, but also something that's going to help with the swelling and the inflammation. So we ask the patient then to also eat like softer foods or non-spicy foods when the gums are quite inflamed.
mm-hmm. Okay, doctor, any advice and final thoughts going forward?
Yes, I would like to tell the viewers and it's very important to actually maintain a very good diet. Number one,
Mm,
genetics we can't control, but diet we can control, and our own oral health we can control. If it's a problem of finance, like, in terms of getting a cleaning done or something to that effect, there's always clinics available or there's always help available. People would want to help or will help, maintaining a good oral hygiene for the patient. But what we can do from our side is maintain a good diet where there's an adequate amount of proteins, carbs, fruits and vegetables, more raw fruits and vegetables to maintain that self-cleansing action of our teeth.
mm,
Cut down our sugary sweets, our cool drinks and all of that, and cut down a bit of the refined food. Get back into like how our parents and grandparents lived. They ate raw, they ate fresher foods. Um,
mm,
maintaining good oral hygiene at home, brushing twice a day, very important, especially at night. You know, using dental floss every day or every second day to get the food that is trapped between the teeth. Incorporating a warm saltwater gargle, you know, every second day as well, or every day does help. Try not smoking because it does have detrimental effects. And then maintaining your overall health. If you are diabetic or predisposed to diabetes or hypertension or something, make sure that it is controlled so that, the effects are not that considerable in the mouth.
mm-hmm. All right, so doctor, thank you so much for your time and for enlightening us on the major causes of tooth loss and what we can do about it.
Thank you so much for having me.
All right, have a wonderful day. Bye bye.
You too. Thank you. Bye.
Dr. Bhavesh Vallabh, a dentist, taking us through some of the major causes of tooth loss and what losing teeth can tell you about your health. So, guys, get yourself checked out at least twice every year, or once every year if you cannot make it to go twice a year, because your mouth could be telling you things about your health that you did not know. And the tooth loss doesn't have to occur as we age. When adults lose a tooth, it's usually from knocking it out or having poor oral health. There are a variety of oral health conditions that can lead to tooth loss, like dental cavities and periodontal disease. Those are the most common. When we're young, if we have a poor dental health routine, we're going to carry those habits with us into adulthood. But if we're aware of the impact that our oral health and tooth loss can have on our lives, we can take proper care. When we practice good preventative dental care, the likelihood for cavities and oral diseases drop dramatically. And like the doctor said, it's simple things like brushing twice, using floss, eating healthier, drinking lots of water, eating a lot more raw fruit and veggies, etc. So it just comes down to living a healthy lifestyle and having better oral health care. Yeah, yeah, oral health. You are listening to the Mid Morning Talk on Salam Media with me, Maria Makwanda. We will be right back.